Hello, I'm Dr. Hannah Moody. I'm the Head of Science for Breast Cancer UK. Today I'm going to talk to you about exposure to endocrine disrupting chemicals in the womb and breast cancer risk. Hopefully by the end of my talk you'll appreciate that what happens to the acorn can affect the tree. So as many of us are aware, breast cancer rates have increased in recent years and actually have doubled within the last 50 years or so. Now, around 56,000 women and 400 men are diagnosed with breast cancer every year within the UK. In 1996, it was estimated that a woman's lifetime risk of developing breast cancer was around 1 in 12. Today, if you were born after 1960, then your lifetime risk of developing breast cancer has changed to an estimated 1 in 7. So what actually causes breast cancer in the first place? Well, cancer itself arises due to an uncontrolled cell division within our bodies. And estrogen can play an important role in breast cancer because it can actually increase how often our cells actively divide. So as breasts have a high concentration of estrogens, they can play an important role in many breast cancers. Androgens such as testosterone are responsible for male sexual development and characteristics, and they're mainly made in the testes, but they're also made in the ovaries. And really importantly for our context, lifetime exposure of high concentrations of sex hormones, particularly to estrogen, increases breast cancer risk. So let's talk about risk overall. So there is a number of risk factors we can't change, and essentially we know those as the intrinsic risks. There's two that are the most kind of significant factors for breast cancer, and they are being female and getting older. In the UK, around 83% of breast cancers occur in women who are over 50, and essentially the older a woman or man is, the greater their risk of developing breast cancer. Quite simply, aging increases the risk of nearly all cancers, including breast cancer within that group. Also, being born female means a greater lifetime exposure to estrogen and can also mean that you have more breast tissue that can become cancerous as well. And there are other factors as well, such as our family history, having a heavy birth weight, starting periods early, and having a previous diagnosis of breast cancer as well. But at BC UK, or Breast Cancer UK, we estimate that at least 30% of breast cancers are actually preventable. So this means that we're looking at the risk factors that we do have some control over. Things that we can change, also known as our modifiable risk factors. And these include things like our diet, our lifestyle, how much alcohol we consume, our physical activity, our weight, if we're able to, when we choose to have children, breastfeeding them, and also exposure to endocrine disrupting chemicals. So one of these risk factors, as I've just mentioned there, is linked to chemicals we're exposed to. So our endocrine system itself is important for regulating lots of our biological functions such as growth and development. And we have around about 50 different hormones within our bodies. Endocrine disrupting chemicals, or EDCs as they're otherwise known, are essentially any chemical or mixture of chemicals that interferes with any aspect of hormone action. So these are chemicals that are exogenous, so they didn't originate in our own bodies, they've actually come from the outside. So if we look at the diagram here, there's lots of hormones in our body which EDCs can potentially interfere with. And several of these hormones are linked to breast cancer risk, such as sex hormones estrogen, progesterone and testosterone that we talked about just earlier. So the really important thing to take away from this particular slide is that EDCs often act at very low concentrations, which is exactly the same as how hormones act. When we're measuring hormones, they're in very, very tiny quantities. It's the same sort of thing with EDCs. And EDCs can damage our health in a number of different ways, depending on which hormone is disrupted. For example, they may increase risk of diabetes, cardiovascular disease, can even affect things like infertility, as well as hormone-related cancers. And many chemicals are actually found in our everyday products, and some of these are EDCs. Some of these EDCs can actually mimic the actions of our natural estrogens, and in doing so can increase the risk of developing breast cancer. So these include things like parabens, which are used often as preservatives in cosmetics, or aluminium in antiperspirants to reduce sweating, certain pesticides such as the weed killer glyphosate, PFAS, which are also known as forever chemicals. They're often used in food contact materials, such as takeaway packaging. They often have that grease-resistant coating on things. And the antimicrobial agent triclosan, which is often used in some toothpastes. Brominated flame retardants, which can be used in furniture and furnishings to make them more flame resistant. Phthalates, which can be used in perfume. They hold properties that actually retain smells of things. And bisphenols, which are used in different plastic manufacturing as well. One of which, of the bisphenol group, is actually BPA, which you've probably heard of, which has now been removed from many products in the UK, but other bisphenols may still be utilised. So the story of EDCs is really that they were first identified not in a healthcare setting, but actually in wildlife. So back in the 1970s in the US, scientists had actually noticed some reproductive changes in wildlife in polluted rivers and lakes. And by the 80s, scientists from other parts of the world had also seen changes in wildlife, particularly in sewageways. For example, they'd found male fish who contain eggs and testes, i.e. both female and male characteristics. Essentially, what they later worked out was that as this was a result of the chemicals that were found in the sewage that were made up of these synthetic estrogens. In 1991, the term EDC was coined to describe this essentially very large and varied group of chemicals that are mostly synthetic. EDCs are now known to be widespread in the environment and are present in water, soil, air, as well as in wildlife. They've even been found in polar bears in the Arctic, all the way through to penguins in the Antarctic. Essentially, they're usually synthetic chemicals which are taking a long time to break down. So they have this process of longevity within their life cycle. And as we've kind of alluded to, EDCs can also be found in our bodies, in our tissue and our bodily fluids. So many EDCs can bioaccumulate, which means that they can stay in our bodies for a long time. And when in our life we're actually exposed to EDCs is really important. So here we have an overview of the critical periods of susceptibility. And during these periods, essentially the mammary gland is undergoing either extensive development or some kind of alteration. And research suggests that exposure to harmful chemicals such as EDCs during these periods can potentially have adverse effects on normal development. In the case of in utero exposure, these effects may be programmed during essentially early development, but they might not actually have an active effect, might actually manifest into a tangible effect until that fetus has grown into an adult. And we actually have a real-world example of this. So DES, which I'm sure you're all very familiar with, was prescribed between the 1940s and the 1970s to women who essentially had high-risk pregnancies, where it was believed to be an anti-miscarriage drug. It was the first chemical to show to cross the placenta and cause adverse effects that would later manifest in life. In 1971, prenatal exposure to DES was actually linked to a rare vaginal cancer. And since then, there has been a correlation between higher incidence of hormone-related cancers that's been observed in the offspring of women who were prescribed DES during pregnancy. DES itself, as a drug, actually induces epigenetic changes, and it can increase the risk of both breast and uterine cancer in female offspring. Really interesting for DES and potentially very important for us is that it's also shown multi- and transgenerational characteristics, which means that having had that treatment or having had the DES as a pregnant woman, the subsequent offspring that have been generated from that woman are also impacted by having that DES. So it's this transgenerational effect, which is happening. So the development of the female mammary gland begins during the latter stages of the first trimester of pregnancy, and it's really characterized by nipple formation and the branching of the first epithelial structures that will go on to facilitate milk production in the future. And exposure to EDCs during in utero mammary gland development may also increase the risk of developing breast cancer later in life. And there are actually other ways in which EDCs can affect breast cancer risk as well. So one of those ways is by essentially promoting already established risk factors. And one of those, for example, is early onset of puberty. Another would be increasing mammographic density. And we know that both having periods earlier, for example, or having a more dense breast are factors that can increase breast cancer risk. So some studies have shown that perinatal exposure to some EDCs that include bisphenols, so that includes BPA, which we've heard of before, BPAF and BPS, has been associated with early breast development. And this is another way in which EDCs can affect risk later in life, as earlier breast development again is associated with a higher risk of developing breast cancer. Bisphenols themselves are EDCs that are actually a mimic of the hormone estrogen. And animal studies have suggested that even exposure to low concentrations of BPA during embryonic days between 12.5 and 18.5 can cause developmental defects in the mammary gland itself. And these time points roughly correspond to the end of the first trimester in humans, which is thought to be a very critical period for exposure to estrogenic agents in particular. So what maternal effects might this have? Well, exposure to chemicals may be higher in pregnant women overall. And we're not completely sure why this is, but it may be something to do with the fact that we potentially have an increased food and water consumption by a pregnant woman. But as I've mentioned, it's still slightly unclear as to why this is. But it does pose a question and a concern that potentially there may be more exposure through consumption of food and drink, for example, those phthalates that we're talking about in packaging, pesticides in unwashed foods, and PAHs as well. So if EDCs are everywhere, then what can a pregnant person really do to reduce their risk? What are the active things that we can actually do that actually are tangible to make a change? So there are actually some simple top tips that we can suggest to people. Things like including vacuuming and dusting often. That gets rid of some of the residual EDC that's within the environment. Using glass for food storage, going fragrance free. Avoiding cosmetics and personal care products that contain EDCs, as well as avoiding things like non-stick cookware. And to make this easier whilst out and about, there are actually some useful apps already in existence to look at these kind of aspects. These include things like the Yucca app, in which you can actually just scan a product and it actually gives you a kind of a color-coded rating that can help inform you of the health impact of that particular product. So I hope you can agree that what happens to the acorn can affect the tree, and really exposure to EDCs during early development may increase the risk of developing several diseases later in life, and this does also include breast cancer within that. So this is just a small extract from the Royal College of Obstetricians and Gynecologists guidance on chemical exposures during pregnancy, and I've just highlighted a few main points here. Mainly that mothers should be made aware of the sources and routes of exposure, and that information should be conveyed routinely in fertility, antenatal and well woman clinics. And this will help women make informed choices regarding lifestyle changes that can be made to actually minimise their environmental chemical exposure to their unborn child. And it's just to reach out and say, at Breast Cancer UK, we can help support your teams with information around exposures to endocrine disrupting chemicals and concerns people may have. And some of that supportive content comes through some of our guides that we produce at Breast Cancer UK. So these include our EDC in the Home Guide, our Chemical Eye Guide, and our updated pregnancy leaflet, which is available at Stand 17 here at the Midwifery Conference, or you can always email science@breastcanceruk.org.uk and you can ask for resources that you may need. Another way which you can help to support your patients is by taking our breast cancer prevention quiz. This is a simple quiz that essentially gives you a tailored risk score and top tips regarding how you can choose to help to reduce your risk. We also, as I mentioned, have a stand here at the Maternity Festival, so please do come and see us if you're able to. So thank you for listening. If you have any questions or you would like any further resources, please do email science@breastcanceruk.org.uk. All of the information here has been taken from our recently published review on the critical windows of susceptibility for breast development. These links underneath here will take you to our fact sheet on the unborn baby and breast cancer risk, as well as our full scientific review where you can find a full list of references. Thank you very much.